platform. Good afternoon, everybody, and welcome to today's webinar. My name is Katarina Sladakovic, and before I continue, I would like to check if you can hear me well. If yes, may I ask you to write a quick message in the chat. Okay, I hear a lot of positive replies, and that's always good. Thank you very much for joining today. As I said, my name is Katarina. I'm a Childhub webinar coordinator, and I'm very happy to be here today and that we are having this very interesting webinar with amazing presenters. Before we continue, I will just have a few notifications for you. First of all, thank you very much for doing the polls and for all the information. We will have a few more at the very end of the webinar. Also, as you may know, as a regular Childhub webinar attendant, our webinars are recorded. Recording will be available on the webinar page shortly after the session ends for those of you who would like to visit it again, or if you have some colleagues who couldn't join and would like yet to hear what we discussed today. Unfortunately, participants are not able to speak on microphones. Only presenters will have this privilege. However, we invite you to use chat and please be active. Feel free to ask any questions and to share your experience, to let us know if you have heard about the initiatives that presenters will talk about, if you think it would work in your country, or if you have anything else to share during the webinar today. Because we want to make sure that we start on time, I will not use any more time. Maybe just a quick note that in case you have any technical problems during the webinar, please write me in the chat and I will be happy to help you. Without any further delay, I will give floor to Sabine and she will introduce herself and the rest of the team before giving floor to our first speaker today. Sabine, here you are.
Hi everyone, my name is Sabine Rakotomalala. I work for the Global Partnership to End Violence Against Children. I'm sitting here with my colleague Kasia, Katerina and Amanda, who are sitting with me in Geneva in the World Health Organization for the Global Partnership to End Violence Against Children. I'm really happy many of you are on this webinar. The reason we're doing this webinar is very simple. We have Romania and Montenegro. They're the first pathfinding countries that the partnership has had in Europe, and they're doing wonderful work. And we want to give them the chance to explain how they've been able to move from data to a national action plan to action in country and to implementing violence against children programs. So we'll have 4 elements to the webinar. We'll first have a short introduction from Howard Taylor, who is the director of the Global Partnership to End Violence. Then we'll have Montenegro, will be represented by Nela Krinic, who will be from UNICEF, and she'll be presenting the work that government has been doing with support from UNICEF. And then we'll have Liliana from Romania presenting on the work being done in Romania. We'll leave at least 20 minutes, I hope 30 minutes for questions, because that's the most important, that you can learn from what these countries are doing. So I think Howard is online. Is he on? Howard, are you online? No? Then I think I might just start his presentation. Katerina, can you put his presentation on? Katerina, can you put Howard's slides? Katerina?
Yes, we can't hear. Can you take to the administrator that Howard can't hear?
He has to click these buttons. Katerina, can you put the slide on?
Yes, actually it is on. I just asked and participants confirmed they can see. So the presentation is on, I can see it.
I can't see anything. Am I doing something wrong? Let's see. This is not working, Katerina. I can't see the slides. Okay, well, if they can see, can you just give me my computer? I think the slides are open then. Katerina, I can't see it, so then I can't jump slides.
maybe try from another computer because I don't know what could be the problem. Basically, it seems working for me, and I don't know about the rest, the presenters. I can.
Okay, I have the slides on another computer. I'll go through them on. If you can just hit the next slide when I say next slide.
And also, I think Howard should be able to speak now, so we can double check this.
Hello.
Perfect. Over to you, Howard. So I just introduced this webinar in terms of the importance of showcasing the work from Romania and Montenegro. So it's over to you.
Can you wave if you can hear me? Because I can't hear anything.
We can hear you.
You're waving. Can you wave again if you want me to start? Okay, you're waving. This is peculiar. It's really good to be on with you this morning. I'm in complete silence here, and I can't hear anything, but I can see some people waving. Thanks for joining. And once I finish talking, I will hopefully sort out my audio so I can hear the rest of you. I'm just going to give a broad introduction to the conversation and a little bit about where we see the Global Partnership to End Violence is right now and where we're headed. And I'm not sure who's clicking slides, but if I just say next slide, please, if someone could do that. Sabine, next slide, please.
I will be, if Katarina is speaking, I will be happy to do so.
Can we change the slide?
Yeah.
Okay, fantastic. So right now, and the Global Partnership is a little over 2 years old, we really feel that we're at a pivotal moment in the partnership. And this slide is an attempt to summarize that. We all are familiar with the global goals with SDG 16.2, which is our North Star, if you like, of working to end violence against children within 15 years by 2030. The Solutions Summit in Stockholm earlier this year was the first coming together of the ecosystem of the community of child protection and people working to end violence against children. About 400 people, I think 40 governments represented at ministerial level, academics, CSOs, faith groups, private sector leaders. And out of that summit, we felt a definite reinvigorated momentum and political momentum behind the agenda. The bottom right of the slide you can see is a map of the current Pathfinder countries, of which we now have 23. We had 13 at the start of the year, 15 in February at the Global Summit, and 23, which again is an indication, we feel, of the momentum that is growing behind the agenda to end violence against children. There's a little bit of this graphic that's missing, I think, in the middle, which is the front cover of the Inspire framework and handbook. So we also have solutions which we promote, which we are seeing the evidence that are beginning to work. And then the bottom left-hand corner, the graphic of the hashtag #MeToo campaign is really just emblematic of something we see going on in broader society, where behaviors which have for so long been tolerated, unacceptable behaviors, are no longer being tolerated. Now, that's not specific to children and child violence, but we feel it's indicative of something that's changing more broadly in public attitudes. So all of that together, the North Star, the Inspire Solutions, the Progress in Pathfinder Countries, the political momentum coming out of Stockholm, etc., and something that's changing in the broader zeitgeist, we feel positions us collectively as a partnership to really make sustained scale at speed in the next few years. Next slide, please. I'm not going to speak to every word on this slide. I think you have the slides as well. Just to call out 2 or 3 headlines, really. The first is that we are looking in the next 3 years at the Secretariat of the Global Partnership of how we can best support all of you who are policymakers, practitioners, people working at the front line, delivering interventions to end violence against children. And the way we feel we can do that best is across the 3 objectives, the blue line of this slide, of this summary slide of our strategy for the next 3 years. Growing demand for change, mobilizing new resources, and equipping practitioners. The growing demand for change piece is really about how do we get the issue of end violence more firmly on the global agenda, both within practitioners but beyond practitioners. So we grow information and understanding and awareness, and in doing that shift attitudes and behaviors and create the demand, more demand in the wider public for efforts to end violence against children. And there's some specific things within that we'll be doing. Secondly, around mobilizing new resources. Obviously, this agenda takes resources, and we're going to be convening experts, expert individuals and institutions later this fall to start work on a seminal piece around the costs of interventions and the return of investment on those interventions. Some of that information exists already. There are some figures already out there. But we have a strong sense from talking to some of you, to partners in the community, that actually in the community we would all benefit, and it'd be a public good to have a seminal piece of work that sets out the costs of the interventions to end violence against children and the return of investment, and not necessarily just the return on investment at a global level, where there are some very large figures out there into the trillions of dollars, but what the return on investments and the costings look like at a country-specific level. So it's a methodology that can be taken and used at country, both to advocate, but also to inform the preparation of national action plans and implementation. The third area of work, equipping practitioners, is building on the work that Sabine and Cathy, who I think you all know, have begun already, which is making sure that everyone who is working to end violence has access to the solutions, the expertise and the resources they need to make a difference. So solutions being the INSPIRE framework, and as we learn, as we build the evidence around what works, how it works, what doesn't work, and we share that in real time, but also the expertise that we know is needed. Where possible, source locally, and if that's not possible, we can play a role in helping identify that expertise, perhaps regionally, perhaps internationally, where it's needed. Also resources, and we can speak more to our thinking, not just linking to the seminal piece of work to make the case for investing in ending violence against children, but how I think using that as one tool and some others, we can work alongside practitioners to help mobilize resources either domestically and or internationally. Next slide, please. Okay, so this is specifically with regards to pathfinding countries. On the previous slide, it talked about growing the partnership to have 100 countries in it. And as I said, we've seen exciting growth of the number of pathfinder countries in the course of this year. And so we have asked pathfinders, but also asked ourselves, just to make sure that what we are providing as a secretariat with the concept of pathfinding is what countries and experts, practitioners, advocates and others in countries actually need. And this slide attempts to capture the essence of that, of why become a pathfinding country. It's different things for different countries. Sometimes it's all of these, sometimes it's one or two of these, or it's a mix of these. It's usually a combination of the access to resources and technical expertise, learning from others, learning in real time from experience elsewhere in the world, and being able to showcase best practice and share learnings with others around the world. Being part of something bigger, which is linking both across sectors, constituencies, geographic locations, is quite powerful. It sounds a little bit abstract, but we do feel, and partners do say that that's something that they sign up to be a pathfinder for, being something bigger than just themselves, locally or nationally, but part of a global movement growing to end violence against children. And on the right-hand side of that slide, the amplification of voices through joint advocacy. We have a campaign coming up, launching in the new year, specifically looking at ending violence in schools, which we can say more about. Helping shape the global agenda, both by making the investment case and mobilizing new resources. And then through our website and our communications channels, being acknowledged globally for the progress and efforts that you're making on the ground. So there are some of the reasons that people have said to us that we sense that people become a pathfinder country for what's in it for countries signing up to become a pathfinder. Next slide, please. I think we can probably skip over that one because we had that. Well, let me speak briefly. This appeared in a much smaller version on the earlier slide about the pivotal moment that we feel that we are at and in right now. And what this shows is three different types of countries. The broad bucket is pathfinding countries in blue, of which there are 23 right now, and you'll see that geographical diversity, which is exciting because that also informs the richness of the evidence picture that we are slowly starting to build as implementation gets underway in those countries. In black, countries joining the movement are the VAX countries, the Violence Against Children survey countries, who are maybe not yet pathfinders, but either have undertaken a VAX survey or are committed to undertaking a survey. And we're looking at what's the trajectory for countries like that who have a demonstrated commitment already to ending violence against children. What is the trajectory by which they come into the partnership? And we feel that VAX surveys are probably one way in for the countries who are in black on this map. And then the final category, and I'm not sure it comes out quite clearly on this, but the learning sites, which are underlined in the country names are underlined in orange. This is where we're going to go deeper in terms of the partnering that the Secretariat provides. It's going to be 6 countries in total selected across the world. And we're going to partner a little more closely, particularly with a learning agenda in mind, and making sure that we understand in a little more detail than we will be able to in all the other countries, exactly how the commitment to ending violence against children is being implemented, how plans are being put together, how they're being resourced, and how that implementation is unfolding. The implementation science, if you like, of ending violence against children, so we can really go deep in just a small number of countries, hopefully with enough diversity to have lessons that we can then extrapolate and share with everyone around the world. Next slide, please. Okay, this is a visual. Sabine, do you want to speak to this slide on the country trajectory?
I don't know if you can hear me, but I'm happy to. So the country trajectory, and I'll just whiz through it. You should be seeing 6 steps. And these are steps that the governments of Romania and Montenegro have already mostly undertaken. So the first important step is engagement, and what we're looking for here is a public commitment to ending violence against children, ideally from the highest level of government, so that it represents the sectors of health, education, justice, and social services. The second one is a commitment is really putting their money where their mouth is, so appointing a senior government focal point, just as Liliana is in Romania, somebody that will be able to coordinate the multi-stakeholder platform. Then we have as a third step the collection of national data. We're really pushing countries to not develop plans based on what they think or subjective ideas, but really to have evidence on quantitative data and qualitative data so that that can help them inform their national action plan. What are the hotspots? What are the main issues to be addressed? What are the underlying causes? And what are the outcomes? That brings me to the fourth step, which is the national action plan. Again, it needs to be based on the evidence, but also include the 4 relevant sectors. It needs to have a component of prevention and of response. Implementation, of course, the core of it all. Often, and I'm sure you all say it, it's about capacity building, having funds to implement programs. And then very important link to this is the implementation science that Howard was talking about. We have moments where we have bottlenecks. Why is the parenting program not working? Why is the social norms program working in this district but not in this district? And we're here to help you move in that implementation phase. Not to do it, because we have great organizations like UNICEF, CSOs on the ground that are doing the implementation. But if we can help you move along in that implementation, then that's what we're hoping to achieve. And then the monitoring and evaluation of the entire plan. So I'll hand back to Howard, unless I think Howard is done. Howard, do you want to add anything? I don't know if you can hear us. No. Okay. All right. Sorry, Howard, you can't hear. We're going to move on. I'm going to move on to Liliana. Sorry, to Nella first from Montenegro. Nella, over to you.
Good morning, everybody. Hi from Montenegro.
Again now. I think I am.
Excuse me?
Thank you. Sorry, still can't hear anything. So this slide, thanks Sabine for taking the country trajectory one. This is just, again, building on the moment that I spoke to earlier on, that we feel sort of writ large that we are collectively in right now. We do feel there's a particular moment in the next couple of years to make particular progress. Next year we have the high-level political forum, where ministers will report on progress against SDG 16, including SDG 16.2, and there'll be voluntary national reporting in that progress. And then later on next year in September, just 3 months later, heads of government will do the first review of progress against all the Sustainable Development Goals. So we feel there's a great political opportunity next year, both to have that voluntary national reporting, to show progress, to show what's working, to show what's possible, and to significantly grow the partnership and grow the number of countries who are committing to make a significant and sustainable difference to end violence. So we see a real political moment there. I think final slide, please, is the next one, which is specifically around the Safe to Learn campaign. And I think there was a question earlier on from Ivelo. I hope I pronounced your name right. So we are, with others over the last few months, we've been working on scoping and designing a campaign to end violence in schools. And this will be launching formally at the Education World Conference in the UK in January. And the intention of the campaign is very ambitious. to make a real go at ending violence, all forms of violence in schools in the next few years. And we will very shortly be sharing much more information and growing a big community around the campaign. It's very much not just meant to be an advocacy campaign. There, of course, will be an advocacy component to it, but it's really about traction on the ground. We're also looking at a donor compact where some of the largest donors in education globally are looking at the spend that they have and what the implications are for education budgets, and whether there should be some resources within education budgets which become ring-fenced to tackle violence in schools. But what excites us particularly about this campaign, and it's really important to emphasize, this is not a distraction or a dilution or a watering down of the comprehensive approach which is needed to end violence against children. So we still firmly and fully promote the INSPIRE framework, which I think you're all familiar with. This is really a way to galvanize public action and awareness, or public awareness and action, because it's one place every day that children gather. People can conceptually understand schools and children in schools and violence that happens in schools, both between teachers and children. And we saw a terrible case of this recently in Tanzania, where a child was killed after being disciplined at school, or died after being disciplined at school. But where there's also violence between children as well. And that also extends towards sexual aggression and exploitation, particularly between children, between teachers and children. But that's something that people can understand. And we really feel that if we can raise the profile of ending violence in schools, it will actually help end violence both in and through schools, because you can't actually end violence in schools without involving a wider conversation that goes outside the walls of the school into the local community, both to help ensure that violence in schools does end, but also it cascades out into efforts to end violence in the wider community. So it's a specific campaign around ending violence in schools, but we believe it will both pull in the wider community and have an impact within the wider community. And as I say, we'll be sharing much more about that. If any of you, and I see that you do have some specific opportunities coming up, for example, in Bulgaria, if you want to drop us an email afterwards, we can link you to the core team working on this campaign and share much more information than I've just shared there.
Okay, thank you very much, Howard. We're just going to move on to the other two speakers. That was really useful. There are a few questions in the chat, so you're welcome to stay online, and otherwise Kathy or I will try to answer them. So over to Nella. Thank you, Howard.
Hello, everybody. Can you hear us? Okay. Thank you very much for your kind invitation for participation in this webinar. My name is Nela Krnić. I'm Child Protection Officer, and I work with UNICEF Montenegro in this position for 14 years. I have here with me my colleague Ida Ferdinandi, Child Protection Officer, also the part of the team. You see Ida, Nada, who is Child Protection Consultant, and Vladan Jovanovic, our Communication for Development Officer. So, as said before, we are very pleased actually to have opportunity to present UNICEF support that has been provided to the government of Montenegro and other national counterparts during the period of more than one decade. So we can say that as a result of systematic efforts that we have jointly invested in the area of protection of children from violence and neglect, our country has been recognized as one actually of potentially pathfinding countries, and we received and we actually accepted that status in 2017. I would say actually at the very beginning that one of the key formulas for success in our case was very broad partnership that was created around the issue of protection of children from violence, abuse and neglect. There we cooperated not only with the government of Montenegro and civil society organizations, but also with other actors like the Parliament of Montenegro, Ombudsperson's Office, international and regional organizations like other UN agencies, European Union, etc. And all partners in a way supported the country to systematically implement the reform that I will now showcase in this area of protection of children from violence, abuse and neglect. So as you can see, just a moment, on the next slide, then we are talking about child protection system reform in general. We have some strategic directions that are reflected in all major policy documents in Montenegro pertaining to child protection, and that is actually harmonization of child protection system response with the relevant respective international standards and regional standards in this area. A multi-sectoral approach in prevention and response to social problems as a key actually ingredient for success. Then decentralization and deinstitutionalization of the system, which means that the system and the reform itself in this moment is very much focused on development of family and community-based services and on prevention. You will see that in the presentation later. And of course, we have put a strong focus, and it is reflected in strategic documents, on ensuring quality interventions and ensuring having quality assurance mechanisms in place in the country. Also, one of the strategic directions that has been applied in all sectors is individual approach in working with children, holistic approach, and of course ensuring participation of children in each processes that are of the interest directly or indirectly for the life and future of the child. I would say also that Montenegro very closely followed CRC committee recommendations with UNICEF support, and all interventions that are specified in the Article 19 of the Convention of the Right of the Child, general comments that are relevant and actually in CRC concluding observations are somehow reflected in our National Plan of Action for Children in this area. And UNICEF has been providing continuous assistance to the government and other partners actually to realize these goals that are established in the National Plan of Action. Montenegro invested a lot in development of adequate legal framework in this area. So let's say at first that that Constitution of Montenegro actually guarantee full protection of children from all forms of violence, abuse, neglect, and exploitation on one hand, and on the other hand, the Constitution of Montenegro actually prescribes and guarantees direct application of ratified international treaties which have primacy under the domestic legislation, and this is something that's very important because it ensures direct implementation of the Convention on the Rights of the Child in our country and other relevant international instruments ratified by Montenegro, which in a way made our work a bit easier actually in this important area. Just a moment. So, in 2016, actually in 2017, the new family law of Montenegro was adopted, also developed with UNICEF technical assistance, and for this specific matter today, it's important that it prohibits all forms of corporal punishment in all settings by all who have contact with the child, meaning parents, caregivers, and any other person that is in the contact with the child. On law on social and child protection, also developed with UNICEF technical assistance, prescribed children victims of violence, abuse, and neglect as one of the groups of their concern. And through this law, those children are provided with additional social support, and not only in terms of provision of social support services, but also in certain aspects and certain cases of social allowances as well. Criminal Code of Montenegro prescribes sanctions for the acts of family violence and child abuse and neglect, early marriages, etc., child marriages actually. So there are actually many acts, including trafficking, sexual exploitation, and many different acts that are penalized through Criminal Code of Montenegro, which are relevant for this topic. Then we have the law on free legal aid, which was adopted in 2015, which prescribes the possibility for free legal aid for victims of violence, including children victims of violence. and the Act on Treatment of Juveniles in Criminal Proceedings, also developed with UNICEF Technical Assistance in 2011, which mainly defines the work with children in conflict with the law. However, it has a chapter which defines the work of judiciary bodies and other relevant service providers actually with the children victims and witnesses of crime. Actually it prescribes, for example, specialization of professionals, child-friendly hearing in accordance with some child-friendly standards, etc. But we will talk also during the presentation later about that. As a major achievement, and it has been mentioned in the Howard's presentation and also Sabine's, we can say that finally in 2017 our country also with UNICEF technical assistance, developed and adopted first ever strategy on prevention and protection of children from violence. It is a very comprehensive document developed with participation of different sectors. As you can see, all relevant ministries, including health, education, justice, in the Ministry of Interior, then judiciary bodies participated in the process of development of the strategy, and it has established a set of common goals and indicators so that the country can measure progress in this area. And it has established also monitoring body, which is in place on the basis of rotation, meaning that in 1 year, one ministry is coordinating with the process of monitoring implementation of the strategy, and next year another ministry. So somehow it emphasizes the joint and multi-sectoral responsibility of all bodies involved in the process of prevention and protection of children from violence. On the left side of our presentation, you can see the major strategic goals of the strategy, which are related to harmonization of legislation, further harmonization with relevant international standards, of course, improvement of institutional framework so that all these renewed legal and policy framework can be implemented, strengthening of judicial system and other relevant sectors, then change of the social norms, which is very important for this particular aspect. Direct work with children in order to build their resilience to violence, and of course strengthening of the monitoring and evaluation system so that the goals and objectives of the strategy can be more easily followed during the time. Now I'm going to say a few words about a community-based mechanism that was established in 2002 in Montenegro, which we have in 17 municipalities in Montenegro, which was showcased at the summit, global partnership, at the summit actually organized by Global Partnership in Stockholm as the example of the good practice. And you will see why. Actually, we somehow realized that in that time period, the response to violence, abuse and neglect of children was a bit fragmented, very slow, etc. And we supported the Ministry of Labor and Social Welfare and local centers for social work to establish multi-sectoral teams at local level composed of different professionals who can provide more immediate protection and response in these cases. And you can see the major, actually activities that are in focus of work of the team on the screen, and that are prevention, early intervention, individual needs assessment, protection, and networking. Is it all okay? Okay. So as told before, the teams in the beginning functioned with the assistance of UN agencies, meaning UNICEF and UNHCR, and later the state actually undertook the teams and established the teams in 17 municipalities in Montenegro. Up to date, they covered more than 2,500 cases of the most severe violence against children, and they provided those children with adequate protective measures. You can see on this slide actually composition of the teams. In the focus there is a child, of course, and then application of a holistic approach, which means that in the teamwork there is a participation of judiciary sector professional, meaning prosecutor, judges, then Ministry of Interior, meaning police, relevant police inspector, health sector professionals, meaning pediatricians and psychiatrists, then participants from the Center for Social Work, which are lawyers, psychologists, pedagogue, and social worker, and also member of the NGO sector. So these are members of the teams which at the level of municipality or community are in charge for working with the most severe cases of violence against children. What actually resulted, what difference we can notice in the period before we had, before the country established these teams and after, we can see actually on this slide, meaning that old model somehow was slow, insufficient, there were fragmented interventions, and the existence of the teams, as said before, provided some like immediate, more efficient support, more holistic intervention, more multi-sectoral intervention, and somehow faster support. We also, during the time, supported the country to develop guideline, protocol on work of the teams, which ensured uniform work of all the teams across the country. And we can see on the next slide as well that also the system of supervision of the work of the teams has been established, even though it is still under the process of improvement. Some standards that are used by all teams, actually all teams were provided in matrices for risks assessment, recognition, for reporting, referral, further referral of cases, etc. And the 24-hour actually shift for working with children victims of violence has been also introduced because it has been shown through the work of the teams that that's something was absolutely necessary actually in these cases. Although also the evidences, the database and the documenting of the cases has been gradually improved during the time. As you can see, this is the example of Montenegro which was shown at the high-level summit in Stockholm. Here I would only mention that in 2016 our government also established high-level interministerial body for protection of children from violence, abuse and neglect, which is run and coordinated by the Deputy Prime Minister of Montenegro, with participation of all ministries, relevant civil society organizations, ombudsperson's office, and it's really a strong and important body for follow-up of the process and reforms in this area. As a result of our work in Montenegro, somehow we realized during the time that we have not put enough focus on prevention, and we realized that the prevention is our window of opportunity to reach as much as possible children who are at risk of violence or who are already exposed to violence. And because of that, we also in the same time undertook some important steps in order to strengthen our efforts in the area of prevention. So the first thing that we did, we actually supported the Ministry of Health of Montenegro by provision of technical assistance for the assessment of home visitation system in the country, which showed that there is a great window of opportunity for expansion of the system, so that the system can cover and increase its outreach function and in a way become capable not only to provide immediate health interventions as it is the case now to mothers and newborns, but also to be capable to recognize social risks, to recognize the cases of violence, abuse and neglect, and refer the cases to relevant bodies which are in charge for protection and further proceedings. In this way, there is the scenario that has been developed and provided to the government of Montenegro for expansion of the work of home visitation service, and we really hope that the service, which has potential to identify all these families, will be gradually improved in the period to come. In the same time, apart from home visitation service, just a moment. In the same time, we also piloted some parenting programs, initiatives, because we realized the importance actually of provision of the parents with adequate skills and information, how to deal with their children, how to actually support them in education and upbringing of their children, so that, for example, corporal punishment is avoided, etc. And with UNICEF Technical Assistance, a multi-sectoral group of partners was educated to implement the first parenting program, which was officially introduced in Montenegro, and that is Parenting for Long Life Health Program, developed by the universities of Oxford, Bangor, and Reading from UK, and University of Cape Town and Stellenbosch from South Africa. The program, as of now, covered more than 60 parents in Montenegro and was implemented in 4 municipalities. And we have been working intensively on expansion of the program, because we also believe, apart from home visitation service, that parenting programs are the key for success when it comes not only to prevention of violence against children, but also to creation in a way of potentials and actually when it comes to supporting children to be adequately for their adequate upbringing, education, and actually productive participation in society in a later stage. As you can see, also we supported the establishment of the first SOS line for supporting families and parents of children, and also children exposed to violence, and the service of family outreach worker, which is very important service, which primarily supports families to prevent family separation and some social risks. This service is implemented in 6 out of 23 municipalities in Montenegro and has covered from 2016 225 children. And the most important thing is that it is still in the phase of pilot. However, 100% of children covered by the service remain with their families, and that is the intention of the Ministry of Labor and Social Welfare to expand the service to all municipalities in Montenegro by 2021. And so now, yes, just to say that, of course, in the area of justice for children...
Nella, if I can ask you to wrap up, please.
Yes, of course. In the area of justice to children, we provided important assistance so that professionals in the justice sector area are specialized and provided the specialized equipment for child-friendly hearing of the victims of abuse, neglect, and violence, and also important assistance to Ombudsperson's office and civil society organization to enhance their capacities in the area of monitoring of realization of the rights of children to be protected from violence. I have just one more sentence. We also implemented in Montenegro a big campaign, End Violence Against Children. I explained at the beginning of the presentation that it resulted from the broad partnership of many actors. As you can see, at the launch of the campaign, we had 400 participants, including all ministries, Prime Minister of Montenegro, President of Montenegro, etc. And we had many segments of the campaign, public debates, media communication channels, etc. But we can talk, in the case participants are interested more about that. So thank you, and I'm very sorry actually for taking more time than expected.
Liliana, can you hear me? It's over to you.
Thank you very much.
I have a very hard mission today to present in 10 minutes what Romania have done in the last two decades, but here we go. What we particularly want to share with you is our experience in implementing two INSPIRE strategies: parent and caregiver support and response and support services in the framework of the new integrated approach of the child protection system reform that is now ongoing in Romania and has ending violence against children at its core. This approach is balancing, on the one hand, the closure of process of large old-style institutions and developing alternative-based services, and on the other hand, pushing up prevention and by building up capacity at community level. Why closing old-style institution and developing community services is effective in preventing violence? Because for the children in these institutions, this approach improves the individual situation of each of them. They are no longer isolated geographically, but integrated in the community. Parents have easy access to visit them, while the small number of children allow better personalized care provided by the staff and reduces peer-to-peer violence. In the same time, for children at risk in the communities, having response and support services is preventing them to end up in forms of violence that might separate them from the parents. Providing parent and caregiver support addresses the risk factors as poor parenting practices or domestic violence, alcohol and substance abuse, or psychological disorders of the household members. In other words, the risk factors for separation I just mentioned are at the same time risk factors for abuse and neglect, as revealed with no exception by literature and by research. Once violence is identified, reported and investigated, the child might be separated from his or her parents if the risk is high. Now, to put this approach in the national context, Romania's efforts to tackle violence have grown progressively. Steps were taken to successively adopt national legislation to ban, prevent, and combat all forms of abuse, neglect, traffic, or exploitation. By the law on the protection and promotion of the rights of the child adopted in 2004, Romania became one of the 54 countries worldwide that fully bans all forms of physical punishment of children. On the other hand, social services institutional capacity was built up in all of the 47 county services for child protection and at central level. These county services are responsible for children that are in state care, while the local level is expected to take care of the most vulnerable families in the communities, providing support in all situations involving child risk factors for violence, a role that is still a challenge for the local communities. On policy level, Romania's national strategy for the protection of the rights of the child was developed with technical assistance from UNICEF Romania through a multi-stakeholder, multi-sectorial consultation, including NGOs, academia, and children themselves. And the strategy concentrates in one of its 4 pillars: the objectives and measures targeting specifically violence against children. There are 2 more strategies, the National Strategy on Health and Social Inclusion Strategy that are approved to support as well the development of an integrated community approach and delivery of a minimum package of services to address violence against children at grassroots level. Talking about consultation and coordination, the National Authority for Child Protection, which by the way is the focal point through its president, Mrs. Gabriela Coman, the National Authority has a coordination council established by law with the main role to improve and strengthen intersectorial cooperation of all relevant public and private actors in the area of child protection. You can see there that we are talking about central ministries relevant for the topic, but as well County Council National Union or Association of the Executive Directors of the County Child Protection Services, NGO Federation for Children, Professional Association of Psychologists and Social Workers, and the Ombudsman. Besides this national forum, where important strategic lines and significant projects are discussed before initiation as well as during implementation, a subcommittee of the Coordination Council is focusing specifically on violence. To confirm the high profile on political agenda, the global partnership was launched nationally in Romania in March 2017 in the presence of the Prime Minister, key ministries and civil society. With this occasion, UNICEF in Romania, in partnership with the Romanian government, launched the 4th year of a multi-annual campaign raising awareness on the forms and consequences of violence against children. And I strongly encourage you all to check the UNICEF website to see all these wonderful campaigns, and I'm sure you will find inspiration for your own work there. But how was the situation at national level? The structural changes in the child protection system that I already mentioned led to a decrease in the number of children in institution from 100,000 in early 90s to around 90,000 in 2017. The distribution also changed significantly from 100% residential to 1/3 residential, 1/3 foster care, and 1/3 kinship care. But still, the number of children entering the child protection system remained relatively the same, keeping the system under pressure and showing that alternative services were developing, but preventing child separation from their families was not following the same trend. Under these circumstances, it became obvious that further implementation of the child protection policy needed to be better evidence-based in order to be effective. So the situation of children in state care was systematically analyzed in the national authority UNICEF Romania and World Bank National Study from 2016. Based on the results of the study and in order to balance the gaps and overcome the consequences, the national authority developed last year a unitary national set of methodologies for closing the remaining institution while developing plans for setting up support and response services for the families in the resource communities that children were coming from. Deeper research was also performed for a complex diagnosis of the remaining institutions to better understand the needs of the children on the one hand and to prioritize the closing process on the other hand. In the same time, a mapping of the prevention services in the resource communities was conducted in respect to children already in residential care, but also those at risk of violence and separation from their parents. For the development process of this preventive component, an essential role was played by the evidences from strategic projects, such as the one developed by UNICEF Romania, aimed to increase the capacity of local authorities to support parents in their nurturing and educative capacity. Developed and implemented with support from all levels, as you can see, it's the central, the county, and the local level. The project hired and trained community workers to carry out mainly outreach activities and to provide a minimum package of services to the most vulnerable children and their families, including here needs assessment, informing, counseling, but as well monitoring. And if you follow the link, you will see the presentation film describing the mechanism of the project in detail. This modeling project also developed Aurora, which is an intelligent online application set up as a tool for ensuring a unitary identification methodology of vulnerabilities by all community professionals and facilitating the generation of integrated services plan for children and their families to be provided by or with support from these community professionals. At the same time, Aurora provides real-time monitoring of the field work as well as data aggregation at various levels, community, county, project level, at any time, enabling evidence-based adjustment of policies and various interventions in a timely manner. Aurora methodology includes a revised list of vulnerabilities and indicators for their measurements in 6 dimensions: in poverty, in health, education, risky behaviors, housing, family, and social status. Data collected on children and their families are reconsidered every 9 months or before, if appreciated necessary, by community workers, providing the dynamic of each household and the adjusting measures necessary. The results of the project, as you can see, were impressive. In 34 rural and 11 urban communities, 48,000 households were visited, and 121,000 people were interviewed, with 20,000 vulnerable children identified and 41,000 vulnerabilities addressed with services. At the end of the project, all beneficiary children had an identity, were registered with the health insurance system, and separation from parents was prevented in situations with this kind of risk. What we envisage for the future? A couple of steps. It's first drafting, submitting, and evaluating projects for closure of institutions and development of preventive services. While considering a first and a second round as well of project submission, should the first one not provide all the expected planning for closures of all style institutions, that needs to go through this process. Operationalization of the minimum package of services and transferring into practice by hiring at least one social worker in every administration at local level. Designing a child monitoring and tracking system in order to have a clear evidence of both children at risk in the communities and those entering the child protection system. And last but not least, strengthening the human resources capacity at local level to properly implement the minimum package of services, do the need assessment and screening of vulnerability, as well as the planning of support services for the vulnerable families. While these steps will be implemented, our goal, that is the transition to and the development of an integrated community approach, will be achieved, facilitating the delivery of a minimum package of services aimed to prevent and combat violence against children at the very grassroots level. Thank you. Okay, Sabina, I think we have 2 questions. Can you hear me, Sabine?
It seems like we have
Liliana, we can hear you, and until Sabina is fixing her connection, maybe there is a question if the Aurora program is collecting administrative data, so if you can help with this until the connection is back.
Okay, I will hand over this question to Vojka Pop, who's the Child Protection Officer in UNICEF Romania, and is taking very good care of this project.
Yes, Aurora is collecting also administrative data, including personal data and identification numbers, so that this tool is made connectable, or is offering the possibility to be in interconnection with other systems, collecting data in health or education or social protection. I'm not sure about the following question, but I just want to anticipate and say that data protection is ensured for all data which is collected, and we try to make the system compliant with the new regulations on GDPR, because this system is supposed to be transferable to the national authority.
Thank you very much. Is this the complete reply to the question? And if yes, maybe we can share a few updates. We agreed with all presenters that we will share the presentations also on the webinar page after the webinar. Many of you asked, so here is a good news, and maybe we can also go through the chat, going down up and check a few more questions that you posed during the presentations. Indeed, many thanks to all presenters. It was very interesting to hear all your experiences. And I see here a question from Ukona, if I pronounce this well, if not, my apology, saying that this was indeed an interesting presentation, but maybe referring to Montenegro case. At this point, I'm not sure, but it says that I'm keen to learn more about the process leading to more children involvement. Can one of you explain this aspect in the Montenegro-Romanian theme?
Can you repeat the question? Working closely with?
A bit more details about the process leading to more children involvement. If maybe you can also refer to some documents where people can learn more about the activities that lead to more children involvement that you are implementing.
We understand that the question is about involvement and participation of children in a variety of policy development. In case of Romania, we can give two examples. While UNICEF was providing technical assistance to the development of the national strategy on the promotion and protection of child rights, there were several consultations, and I think Liliana already mentioned the variety of actors that contributed with input, feedback, and a lot of comments. But there was also a group of children which are part of the National Students' Council that were participating to the last consultation processes, and actually they came up with a suggestion for an additional pillar, the fourth pillar in the national strategy, which is about child participation. And made some suggestions with regards to strategic directions to be followed in order to improve and strengthen child participation and consultation in a variety of processes that affect their lives. Another one is linked probably much more to the local action, local implementation, and for example in Aurora there is a particular section which is dedicated to children, and I must say that every child above 10 is invited to participate, and if they are willing, they have a completely separate section of questions, and the community professional is conducting a sort of an interview dedicated exclusively to children above 10. Obviously, parents have to consent to this, and there is a written form where they have to sign. Children above 14 can also sign a written consent. But we are very happy that out of the very large number of children involved into this assessment of vulnerabilities, many of them are children who actually participated and from whom we actually heard directly without intermediates with regards to their problems, issues, needs, and so forth.
you very much. I have to note that we are over time. We have many more questions, so I would like to see if it's possible to make a compromise to agree that we stay 5 more minutes longer if for both teams, Romania and Montenegro, this is fine. And then to promise to participants that we will address all the questions via email. So basically that we will copy questions from the chat, you will answer, and then we can send the written replies not to stay much more longer. Is this good for both teams, Montenegro and Romania? 5 more minutes?
Yes, for Romania it's fine.
Montenegro?
Yes, okay, yes, of course, it's fine. If you would like, we can share our experience when it comes to child participation.
Definitely, maybe I can just read the 2 questions that are related. One follow-up from Ukona asking how to address violence among children of the internally displaced people. And then Elena, following up on this question, asking how does child participation challenge social norms? Does this step contribute, in your opinion, to the objective to shift social norms? And maybe you can combine in your answer this as well.
Okay. So when it comes to children of IDPs, I would actually say that we do not have anything particular to say because in a way, Montenegro invested efforts to build a system of child protection, which is relevant for all children, you know, who are potentially can be exposed to violence, abuse, and neglect. I can only say that when it comes to some ethnical minorities, let's say, for example, Roma and Egyptians, that we have special programs and we educated professionals how to work in a more culturally sensitive way with this population. However, when it comes to IDPs, the same approach and the same status as for Montenegrin citizens is applied. So I cannot see any difference, you know, in terms of working with children as well. That would be something as a general. When it comes to child participation, I would say that generally we also, as Romania, had some experiences of effective child participation in decision-making processes, but as a general rule, we have been in the process of trying to foster child participation in many aspects, you know, as much as possible. And for example, in our amended family law from 2017, now we have obligation for children to participate in all proceedings that concern them directly or indirectly, meaning obligations of professionals to ensure children's participation. I would add one interesting example from Montenegro that was implemented by Ombudsperson's office. Actually, they had a campaign which was called Children Right to Ombudsman. During that campaign, children wrote about many different aspects which pertain to child rights violations. One of very prominent aspects was violence against children, and as the basis of children inputs, the comic on child rights was developed, and one of the major topics of the comic is also protection of children from violence. And this comic became during the time additional teaching tool for civic education subjects in our primary schools. So that is, for example, one interesting example of child participation. And we also worked with adolescents as well. And I would kindly ask Ida for one sentence, my colleague, in these terms. She can explain actually this process.
Mm-hmm. Hi, everybody. To be really brief, a couple of years ago, we as the UN system supported national partners to develop an interactive theater play for adolescents on violence, and this was based on focus groups with adolescents. So adolescents themselves identify topics, and one of the most prominent topics when it comes to violence between adolescents is violence in intimate partner relationships. So this theater play was then played in a number of schools, more than 300 children attended, and we're now going to expand this with private sector funding and to have more of such awareness raising and adolescent engagement activities. And just to mention one more thing, UNICEF in Montenegro has a Youth Innovation Lab, and we have these upshift events where we gather children to devise some social interventions to implement in their local communities. And we will have a thematic upshift at the end of October, beginning of November, which is going to be about violence against children and adolescents, where they will devise some social interventions, how to resolve such cases.
Very much. I see here that we have 2 questions from Kiran at the very beginning during Montenegro presentation, but I think both of them come to a point about the abuse of children by children inside the residential care and sexual abuse of children inside the institutions. So do you have any recommendations on how to prevent and address such abuses, or if you can again just maybe direct to some of the studies done, or maybe we can also answer this in an email.
Should Montenegro respond? Yes? Yes? Is it? Yeah? In Montenegro, we supported the Ministry of Labour and Social Welfare to develop a safeguarding policy for children in residential care institutions. And we also supported some other service providers to develop safeguarding policies. And we did this in cooperation with civil society organizations, parent associations or youth associations. So we do have experience with this, and it worked really well.
Anything to add? Okay, I think the connection is not really good, so while we are waiting maybe to restore a microphone, just a final comment. First of all, thank you very much for joining today, everybody. We hope it was interesting. Please answer the polls for a short while. They were closed, but I reopened them. It was by mistake. So please give us your feedback. We are looking forward to it. We hope this was interesting. We ask you to keep tracking the Childhub webinar page for the upcoming webinars. We will have plenty this month and plenty until the end of the year on different topics. And of course, as you may know, all participants of Childhub webinars are entitled to receive a certificate for attendance if you would like to have one. So I copy in the chat the email address. I hope everybody can see info@childhub.org, and then basically if you write us on this email requesting a certificate, we will be very happy to send you. Before I thank everybody, first many thanks to our presenters and then to all the participants for being really patient and staying overtime with us today and for posing so many interesting questions. We promise to get back to you on them. Before I officially close, do we have any final comments from our teams, or maybe you can just shake your head or nod if you have or don't have anything. Sabina is good? Okay, Romanians are good. Montenegro, we haven't seen you this webinar, but maybe you can say, or if we are done, then once again, thank you very much for joining today, and we are looking forward to having you on our upcoming webinars as well. Greetings from Budapest. Have a nice afternoon. Goodbye, everybody.
Bye.